Hi, I chose to do my research on acute appendicitis. Acute appendicitis is a condition in which the appendix becomes inflamed and filled with pus, causing an infection and severe abdominal pain. The appendix is located in the lower right quadrant of the abdomen, and it is more commonly seen in children than adults. Some other signs and symptoms that someone may present with include lower right quadrant pain, rigidity, paraumbilical pain, nausea, vomiting, loss of appetite, abdominal swelling, and fever. There are a few ways to go about diagnosing someone with acute appendicitis. One of the first ways that someone would do so would be administering a PAS score, which is a pediatric appendicitis score, and that is just a assessment that is given to the patient to determine their likeliness of having acute appendicitis, and it places them in categories low, moderate, and high risk. A CT scan is considered the gold standard in diagnosing someone with acute appendicitis only because of the great detail it reveals and the high sensitivity and specificity of the test. An ultrasound will help determine the inflammation surrounding the appendix. An MRI will help determine the appendix diameter, wall thickness, and the intraluminal fluid surrounding it. If acute appendicitis goes undiagnosed, risks such as abscess formation, perforation, and general peritonitis can occur. Peritonitis is a tissue that lines the wall of the abdomen, and that just becomes inflamed or irritated, causing the patient pain. When it comes to treating or managing someone with acute appendicitis, there are one of two options, either open laparoscopic appendectomy or an antibiotic therapy. And typically, surgery is one of the last options that a patient will, want to have. So antibiotic therapy will attempt to get rid of the infection without an invasive surgery. However, an open laparoscopic appendectomy is considered the gold standard, and even if somebody does receive the antibiotic therapy, they are typically going to need the appendix removed later on down the road. It might just be a temporary fix. Some other common pathologies that can be easily confused with acute appendicitis include kidney stones, diverticulitis, peritonitis, ulcerative colitis, and gallstones. It is important to correctly diagnose and have confirmed the pathology through imaging in order to treat the patient the way they need to be treated. Thank you.